Thank you, sir. Without further ado, I request sir to enlighten us with his keynote address.
Good afternoon to all of you. I am very happy always to visit SVSA campus, but I was telling Dr. Ramakrishna that today is the first time I actually went inside the Ayurveda building. I have come here on context of yoga many times. I knew about Sushrutha Medical College, but I had not really visited. I am happy to see the growth of the Ayurveda Medical College here. I also feel that as Dr. Gangadhar and others were saying, we need to make a revolution in Ayurveda becoming a part of the mainstream medicine. Even today that has not happened. That is very unfortunate. So I believe that actually if you look at medicine, all medicine is truly integrative. If you look at the family physicians of the early 1950s and 60s, they were actually practicing integrative medicine. Unfortunately, in the wave of specialization, we have lost that ability now, where a person only looks at one part of the body and a disease in one part of the body. Now, that is not going to yield results, as we have seen. As an example, I had a recent patient referred to me from Pune who had 3 operations done in his arm. One in the shoulder, one in the elbow and one in the wrist. All done by 3 different surgeons who are specialists of the elbow, the wrist and the shoulder. His pain had still not gone. Most likely it is a psychogenic pain. You know, this is the kind of medicine that we are practicing, that a person is like a horse who looks only at this part, and modern medicine unfortunately has been led into this ever-increasing specialization where every person knows a lot about just one part but does not look at the person. So this is where Ayurveda really comes in. So I would try to, I would try to talk here. I am not going to talk any Ayurveda. I cannot talk Ayurveda in front of the, the Diggajas of Ayurveda here. I have no much knowledge of Ayurveda. What I am going to say is, what does modern medicine expect from Ayurveda? What is it that we need from Ayurveda so that we can integrate into one medicine? That's the theme of my talk today, but I am going to illustrate it by focusing on neurodegenerative disorders. So I was very happy to meet Guruji, Didi, Dr. Manjunath, Dr. Gangadharan, Dr. Vyas, Dr. Rao. I am very happy to be here. But I should really thank Dr. Ramakrishna for bringing me here. He promised me in the recent Aroha in All India Institute of Ayurveda that we are going to conduct a conference and that you please come. So I had promised him I will come. So here I am. So this is my, what do we mean by, I am going to talk about neurodegenerative disorders. I don't have much knowledge of arthritis or the other chronic, other medical systems. I am going to focus on neurodegenerative disorders. Now, why we need Ayurveda to come in, why we need to integrate, particularly for this kind of disorders. What have we done? Briefly, I would give a glimpse of what we have tried to do at NIMHANS, some examples and lessons learned, and ultimately, like I said, what do we expect from you people? So this is generally the disorders which come under the category of neurodegeneration. Of course, Alzheimer's now, everybody knows about Alzheimer's disorders, but there are also a host of other cognitive disorders. And as many speakers said today, once you really have Alzheimer's, there is nothing much. I think Dr. Manjunath mentioned it. It's only most likely improving quality of life. You have to intervene. We now know that people who are going to get Alzheimer's 10 years down the line already have the signs and symptoms 10 years before. This is where we need to intervene, not after the person has been diagnosed with full-fledged dementia. Then the options are very, very limited because the neurons are already dead. So there is nothing that you are going to be able to do there. And this is a trend that I have noted unfortunately, that people turn to Ayurveda and yoga after exhausting everything else. This is absolutely a waste of the way that you look at Ayurveda and yoga. People with stage 4 cancer, people with advanced stage of dementia, there is no role of Ayurveda and yoga at that point of time except improving quality of life. Even modern medicine doesn't have any treatment. You need to look at it much before, and there is where technology comes in. How to detect these disorders early so that we can intervene. Let's say somebody is going to get dementia at 80. If you detect at 70 and start treating, he may develop dementia at 85, 86. Now 5 years of a person's life is an extraordinary period where the person could do so many things. That's the aim that we are doing. Parkinson's disorder is again becoming quite common as India ages. Many people have attributed it to a host of, why do we see so many Parkinson's? It is primarily because people are living longer and people are exposed to more toxins, which may be in terms of chemicals, which may be in terms of pollution, which may be in terms of, the stress of everyday life. So Parkinson's has become quite common nowadays. Huntington's, of course, is a genetic disorder which anticipates in each generation. It comes earlier and earlier in each generation. It is something that we have to detect genetically. Multiple sclerosis is again something which is becoming a little more common. It was earlier thought that it was very less in India. It again is a disorder that particularly affects females. And I have seen more in Europe, but now we see so many cases. Dr. Netravati, my colleague in NIMHANS, is a specialist in multiple sclerosis. And we have even seen cases induced by COVID vaccination. So it is an autoimmune disorder where the demyelination happens. So the myelin sheath, as all of you know, which is responsible for neural transmission, that gets damaged in this disorder, and it's very difficult to reverse this. This comes in various stages. Some people have a milder disease where they have blindness for some time, then it goes away, then it comes back, so-called relapsing remitting. Some people from the beginning have very severe multiple sclerosis. It is a autoimmune disorder possibly caused by reaction to minor infections before. Motor neuron disease is a chronic degenerative disorder where the neuromuscular junction deteriorates and people end up very badly paralyzed. Amyotrophic lateral sclerosis or Lou Gehrig's disease. Some of these disorders became famous of people who had it, some very famous people. Lou Gehrig was a American football player. It's named after him. Again, something that strikes in the prime of life. You can look at Alzheimer's and Parkinson's as disorders that spare us in the prime of our life. At least they come at 60, 70, 80. These disorders come at 20, 25, 30, where the person is trying to make his or her life, and therefore they are much more destructive to the person and the family. So these are very, disastrous for the family. And these are some conditions which have genetic links: spinal muscular atrophy, spinocerebellar ataxia, which affect the movement system of the body. Of course, there are a host of pharmacological options. I am not going to go into that, but most of them focus on symptomatic change. Most of modern medicine now is as you saw during COVID. You can use steroids, you can use whatever antiviral, but all of them are only going to give you some symptomatic relief. They cannot cure the disease nor reverse the disease. That's not possible in COVID. Unfortunately, we erased it a bit late. Of course, there are a lot of psychotherapeutic and psychosocial interventions to improve the quality of life. Brain stimulation is a new paradigm for some of these disorders which can actually help. There are a host of brain stimulation techniques. I am going to refer to them in my talk. And the gene therapy, although it did show a lot of promise, we are nowhere near achieving any great results by gene therapy as of now. That is something that probably for the future. Why should Ayurveda come in here, or why should integrative medicine? We all know the limits of medications. I was just saying that most of them give only symptom relief. most of the interventions, even you take a common disorder like hypertension, we have anti-hypertensives, they keep the blood pressure under control, but it's not treating the root cause. And if you look at the modern treatment system, we have been able to achieve great results just by keeping the blood pressure low. Now, if we add something that actually works on the root cause, like Dr. Manjunath was talking about diabetes, if you can reverse, that is where really the revolution will happen, and then you can possibly, have what Ayurveda describes as 120 years of life. Right now, we are not in that stage. And psychological approaches, the pragmatics all over the world are very difficult, particularly in India. To find a good clinical psychologist in rural India is next to impossible. It's like finding a gold mine. The good thing is what has happened in the last 20 years throughout the world, as Dr. Gangadharan was saying, Germany, Australia, they are all investing in integrative medicine research. In a few years, their Ayurveda protocols will be on par or better than us. So a lot of work is happening with modern research methodology. Luckily in India, a few institutions including SVYASA have actually taken up research very strongly. I am very happy about it. That's one of the reasons. If you look at you put a PubMed search of yoga and Ayurveda research in the last 20 years, you will see like it has gone up like Mount Everest. Now that's something that's very good. And the good thing again is, a lot of studies, a lot of meta-analysis have shown that if you combine a modern treatment with a traditional treatment, the results are not just 1 plus 1, it is 1 plus 1 is equal to 3 or 4. That's the remarkable thing that we have seen. For example, adding yoga or Ayurveda, particularly in mental illness, which is my specialty, we have seen that the benefits sometimes not, we didn't even expect that. So, Dr. Gangadhar often gives a very good example of one of our patients who had negative symptoms of schizophrenia, and he had taken medicine, the positive symptoms have all gone away, but he did not have any interest and he didn't really do anything with his life. Then he started coming for yoga, and around 1 year later, his mother came and told Dr. Gangadhar that, "You have given my son back to me." He asked her what it meant. And she said, so yes, his delusions, hallucinations have gone away long back, but he had no interest in anything. This year on my birthday, he remembered my favorite color, and he presented me with a sari. Thank you. So that is the remarkable thing that yoga did in a condition like schizophrenia. So Hutchison, of course, all of us know, is the master of clinical examination and clinical medicine, and he gave a word of caution saying that in our urge to look at new things, we should not forget the old. This is very important because the renaissance of traditional medicine is because we have come a full circle. We started by saying, it is probably the result of, following the Cartesian dichotomy of, that body is a machine and the mind is something not connected to the machine at all. So that is the way that we looked at it, and in that context, like I was talking about specialization, we are running behind newer and newer things and forgetting the root causes. This is another author I follow very much. He is actually a theoretical physicist, a nuclear physicist, but he has recently turned his interest in the area of looking at where we are going wrong with science. And he says here, if you can see here, the problems that biologists cannot solve today all seem to be related to the function of living systems of wholes and their interaction with the environment. For example, the integrative action of the nervous system remains a profound mystery. Fritjof Capra is a famous author of many books on this. Particularly, this is a recent book called The Turning Point, where he says that now science has to look in a different manner. We have tried to break down the nucleus, the proton, the electron, and all those things, subatomic things we have done, but we have not understood the macrocosm. So he now talks about integrative medicine as well, where he says, as I said, the Cartesian division. So Descartes, who gave this thing that I think, therefore I am, he said, okay, body it can be broken down into its constituent components, and mind and body are separate. This dualism has actually taken us back nearly 300 years because we lost track of the integrative part of it. So we are now trying to reverse the trend and going back to what we did before. Why should we look at neuropsychiatry? Lot of evidence now says that everything is a systemic disorder. Somebody was talking about inflammatory markers. If you look at a person with depression, with no other medical condition, all the inflammatory markers will be high. Whether you look at CRP, whether you look at any of the cytokines, all will be high. Why is it? He has no diabetes, he has no hypertension. So depression also is a systemic disorder. The only thing is the expression is different because the areas of the brain involved are different. Let's look at epilepsy. Let's look at bipolar disorder. The mechanism is the same. Why one person comes with seizures, another comes with mania is just because the areas involved in the brain are different. So these are all systemic disorders which express themselves in different ways. If you look at the connection between depression and diabetes, it's a very, very strong connection. If you have diabetes, you are 3 times more likely to get depression. If you have depression, you are 2 times more likely to get diabetes. So what is this showing us? That all these are interlinked, and we need to look at it as a systemic approach. This is the strength of Ayurveda. That is where we need Ayurveda to come in. What we now talk about the DOHAD, developmental origin of health and disease. This is a very important concept that we now talk about in what Harvard has dubbed as mind-body medicine. We may call it integrative medicine. So they have used the word mind-body medicine because the Americans always want to be different. They can't follow the rest of the world. The rest of the world drives on the right side, they want to drive on the left side. That's how they are. So they call it mind-body medicine. But you will be surprised to know that in Harvard today, Harvard Medical University today, any medical postgraduate joining Harvard, it is mandatory to undergo 1 week of mind-body medicine. It is mandatory. Is there any Indian university where is it mandatory? You are saying about people or students are asking why we should learn yoga. I am a commerce fellow, I am an engineering graduate. So there it is mandatory. And the course is conducted by Darshan Mehta and Satbir Khalsa, mind-body medicine. It's mandatory for all because they recognize the damage that stress is doing to medical professionals. My own PGs, many of them themselves are having depression, So we take 40 MDs a year now in psychiatry, and at least 2 or 3 will have depression because that is the nature of the illness now, the stressful life that we are living. But it all starts in the womb and it starts in the first few years of life. This is the seat of even degenerative disorders which come much later. Which is why, for example, Garbha Sanskara is something that the West is now taking up. We had just last week we had a talk by Dr. Lakshmi Prasad from Sringeri on Garbha Samskara in our integrative medicine department, and it is a well structured thing which has been described in Ayurveda long back. We have forgotten it, now the West is reinventing it. In England there are many natural birthing centers attached to obstetric hospitals where they follow this Garbha Samskara method, including music. Indian classical music they are using during the second trimester because they have gone through the Garbha Samskara. So this is something that we need to remember, that if the child in the fetus in the womb and the early infancy are healthy, very likely that the person is going to have less chance of developing neurodegenerative disorders. So early life stress strongly increases the risk of almost all the neuropsychiatric disorders. Not only that, risk of obesity, diabetes, cardiovascular disease, all these are linked to early life stress. So people who are going to have a child, they should think of it at that stage. It is not, you can't really change much when you are 40 or 50, maybe you can change 5 to 10%. If you start early, you can make a whole difference. So there is a very nice chart which the number of adverse the problems that you have as a child links to the number of disorders that you have as an adult. So what is called as the PNIE network, Psycho Neuro Immune Endocrinology Network. This is the catchphrase now in medical research. Everything runs through this network which involves the brain as well as the other organs. And as Dr. Gangadharan mentioned, the gut microbiome, what is called as the second brain. The gut is now given its due importance in almost every disorder. IBS, for example, they are actually doing fecal transplantation. People are doing fecal transplantation, which is supposed to be a cure for IBS, you know. So that is the kind of thing that is going on now. All these are involved together. And what, you know, all this together cause what we now call as the metabolic syndrome. So very likely that if you get a patient with diabetes, he or she already also likely has hypertension, likely has dyslipidemia. So all this come together as one thing. A diabetes specialist, if he looks only at diabetes, you know, it's not going to solve this problem. There is one important concept that all of you should understand, what is called as allostatic load. This is the core where actually the rationale for Ayurveda and yoga comes in. What is allostatic load? You know, so we all have heard of word of homeostasis, right? Homeostasis means how the body and the brain maintains its status irrespective of the outside. For example, yesterday it was cold, today it is very hot. You know, I probably made a mistake in wearing this dress today. I was expecting it yesterday. But my body will adjust. You know, we have an immense capacity to handle cold. We live in Siberia, we live in Congo, where the temperatures, go from 50 to minus 30. Now, people live everywhere. How do we manage? This is because of what we call as homeostasis. That's a constancy of the inner milieu of the body. But how does this happen? This happens because of what is called as allostasis. So allostasis is the mechanism by which the body adjusts. Say for example, when you feel cold, what is the natural reaction? We shiver, and that increases the heat production in the body, right? So when we feel hot, we sweat, we lose heat by sweating. So this is allostasis. So allostasis you can compare to something like a shock absorber, you know. When you come to SVSI, you will be definitely reminded of the shock absorber because of the Bangalore roads. So that is something that we really need. So this, students, I want you to really remember this figure. This is a very important thing, that if you look at the extremes, you look at the blue is somebody who is super resilient, who can handle, variation in temperatures, variation in food. Okay, I have 1 meal a day, I am still okay. I have no meal a day, it's still okay. I have 3 meals a day, I should still be able to manage. That is the resilient level of human. Most of us cannot handle so much. Okay, we are still healthy, I have no disorder, but if I don't eat for 8 hours, I start getting gastritis, right? So that is still healthy, but it is not resilient. Next you have little more allostatic load, the yellow graph takes off, and then you have accumulation of wear or tear. Most people come in this category nowadays. I rarely see 50-year-olds without one or the other metabolic disorder. Very rare to see somebody 60 not having anything now. No, that's a rarity. Then you come to actual disease state where you have, clear abnormalities, which is modern medicine puts a cutoff here and says, okay, this you need treatment. What about that side? You don't need any treatment, or you don't need any advice? That concept is still not there in modern medicine, that we do not look at people who are well and try to maintain the wellness. That concept is still lacking, because most of us are busy treating the people who are in the red and the even redder part of the thing. In the end, of course, you have liver failure, you have brain failure, you have heart failure. That is the last stage. So all of us should aim to be in the resilient system, that our shock absorber is still working very well. As you all know, what does that need? What do vehicles need? They need regular servicing. You don't do service, your shock absorber is going to give way. And what is this service? That is the lifestyle management that we call yoga or Ayurveda. So for all treatments, we should conceptualize in this way, that of course you need a disease specific treatment. If your HbA1c is 12, of course I would still advise a anti-diabetic or insulin if needed. Extreme depression, yes, we still give medications, we give ECT if really needed. So that is needed for some people. But there should also be something which reduces your allostatic load. So I'll illustrate this by one study which we did in NIMHANS. We did a 3-arm study of patients with depression, where we allowed them to choose. One group chose only modern medicine, antidepressant. One group took both modern medicine and yoga. Third group only yoga. At the end of the study, at the end of 4 months, what we found, the depression got better in everybody, even the people who took only medicine. But in the 2 arms who had yoga, the serum cortisol went down. In the arm which took only medicine, it did not go down. What does this mean? Now the person is currently okay. What is going to happen when they stop the antidepressant? Because cortisol, what does it indicate? It indicates stress. The stress is still there. Allostatic load has not come down. You are going to expect. Most patients when they come to my OPD, they ask me, "Doctor, I am feeling better. When will you stop the medicine?" My question back to them is, okay, what have you changed in your lifestyle? You tell me. Then I can think of stopping medicine. Otherwise, there is no question of stopping medicine. You need, depression becomes like diabetes. You need lifelong treatment, right? So there has to be something. And we have to aim not just as depression has come below Hamilton depression rating scale below 8, okay, that's good enough. That's not good enough. Person has to be useful to himself. Society means he has to actually attain good mental health. We have to look at wellness. You have heard of the instrument called CGI. It is a global indicator that we all use to determine severity of disease. Till recently, we did not have any CGI for wellness. You have to have that also, isn't it? How well this person is. So now, actually, Dr. Fadke and myself, we are developing that thing called CGI wellness. How well is a person? All based on Ayurveda and yoga. Ultimately, you have to look at, ojas. How is the ojas of this person? So that also has to be measured. And we have been measuring disease, but we have never measured wellness. So we have to build this term, what we call as resilience. And that there is no formula in modern medicine to build resilience. Of course, I need not say this in this campus. We have got this guidance, long back, that we need to be moderate in all the aspects of our life. Yukta. Yukta is very important. Anything that we do to excess is likely to create problems. For example, you heard of a lot of people recently, extraordinarily fit people dying in the 40s of heart attack. Most common cause is lack of sleep. They are so busy running around that they are sleeping 4 hours a day. They are simply not good enough. Because sleep is the most important factor for repair of the body, replenishment of the body. You might be super fit, but if you do not sleep, you are carrying a heavy allostatic load. And that is likely to hit you sometime or the other. And we have even better thing here for mental health, which NIMHANS has put in its logo way back in the 1950s. This comes from the Bhagavad Gita, Samatvam Yoga Uchyate. This talks about the ability to maintain. This is actually talking about homeostasis. It's not just talking about mental peace, but talking about homeostasis. Ability to maintain constancy irrespective of the external situation. Rudyard Kipling in his famous poem, If, I don't know whether he got the inspiration from here, but that's the same thing that he has said, that you have to treat success and failure as the same. If you can do that, that's, so why should we change now? Why do you think modern medicine has become the default system worldwide? Anywhere you go in the world, you are likely to find the same modern medicine system. Why is that? Why is it not that Ayurveda or Chinese medicine became the standard system worldwide. It is because the modern medicine people used standardization. Anywhere you go, the MBBS, almost same kind of things are taught. They have standardized the teaching, the methodology, the examination. Hutchison's is followed worldwide. How to examine a patient, right? It's not that Ayurveda doesn't have it, but we have not been able to standardize it to the extent that modern medicine did. Use of technology. This is something that we have now woken up to. Why did the British were able to rule us? Simply because they benefited from the Industrial Revolution and they did not allow us to benefit from the Industrial Revolution. We lost 200 years of scientific growth during that time. That is the reason why they were able to rule large parts of the world. So technology is a critical factor now if we want to maintain standards in any field. And they were able to innovate and adapt to different situations. Why do we all wear trousers and shirt now rather than a panche? Because it can adapt to any situation, right? Nowadays there are, I think the panche also with the pocket and a, thing. So that is innovation. You need to innovate, otherwise you are not going to survive. So this we have to learn. We have to credit modern medicine for introducing the scientific part, how to do it, right? Their ideal may not be very good because their ideal is to control disease. That's not good enough. But the way they have gone about it is really fantastic. They have managed to do this across the entire world. They have managed to bring one system. It's a remarkable achievement if you look at it, Oh, sorry. So this is something. When people ask what is the definition of integrative medicine, many books are there, but simplest is that you have to have a traditional lifestyle approach to health, which is our Ayurveda and yoga, but you also have to have modern biomedical treatments when needed. In the emergency room, of course, you need modern medical treatment, but most importantly, you have to have good research methodology, technology, and innovation. If you have these three components, any medicine that you are practicing is truly integrative medicine. The era of standalone hospitals, I think, is over. I don't really like standalone hospitals. I have one hospital for this, I have hospital for homeopathy. I don't like that approach because the patient, you are forcing the patient to choose. How does the patient know? I need homeopathy, I need naturopathy, I need yoga. He is not the person to choose. You have to be able to choose. That's the most important thing. One of the most important principles in neurology is called as Hebb's law. So he was not a neurologist, he was a neuropsychologist. He is called the father of neural networks actually. Donald Hebb in his famous book Organization of Behavior says, neurons that fire together, wire together. Once you activate a circuit, that circuit becomes almost autonomous. Why we do the things, why I can stand here and speak at the same time, do this, look at you. I am able to do this because my neurons have got used to this fact. If you ask me, there is a very interesting experiment you can look at YouTube where a person reversed the cycle handle so that if you do this, it goes right. And it's so difficult to learn. The person fell, it took around 3 weeks to learn it. This was around a 45-year-old person. His 8-year-old son learnt it in 3 hours. He could, because the reserves in the brain are much more for children. They are more neuroplastic. He reversed it back. He tried to learn the reverse way. Again, it took him 2 weeks. For his son, it took 1 hour. So that is the ability of the human brain that you can reorganize, and this is what we call as neural plasticity or neuroplasticity. It's a hot term now. It all depends on this system. What you use becomes stronger, what you do not use becomes weaker. So neurons that are out of sync lose their link. This is true for both health and disease. You train your memory. There are many memory training ways. You can have extraordinary memory. On the other hand, it's also true for diseases. Why does epilepsy happen in the same way? Why does a person get a generalized tonic-clonic seizure only? Why he suddenly doesn't get complex partial seizure, something absent seizure? It is because that circuit has become autonomous. It works It gets activated even when it does not need to be activated. That is pathology, right? So the deep circuits, for example, we walk, we swim, we cycle. We will never forget it unless I have a stroke or something like that. I will not forget. How do we not forget? We forget names of people, we forget. So semantic memory depends on new circuits. Walking, swimming, cycling depends on very deep circuits which are so autonomous that you wake up at 12 o'clock in the night, you know swimming, you are put in the pool, you will swim. For example, animals, they can swim when they are born. You put a puppy in a pool, it will learn to swim within half an hour. So that is because it is ingrained in the deep circuits. So that is very, very important. So this is a basic law of neurology. We can use lot of tools now to understand, the brain. I have not put gut microbiome here because that is something that needs a lot of investment, lot of genetic analysis, but these are all things which can be done. I think all of them are there in SVASA. So Anveshana has most of these things. The simplest, starting with the old biochemistry, cortisol, BDNF, which is BDNF is brain-derived neurotropic factor, which is a marker of neuroplasticity. You can use HRV, you can use EEG, you have TMS, I think transcranial magnetic stimulation. I am not sure if SVASA has this, but this is something that we use both as a diagnostic and a treatment paradigm, transcranial magnetic stimulation. A very interesting recent example, we had a psychology graduate from Manipal who came to us with 8 years of continuous vomiting. Whatever she ate, she would vomit. She had been treated as psychogenic, that psychotherapy, nothing worked. Very intelligent young girl, no, she is not trying to avoid anything, there is no suggestion of dissociation, but she could not keep food inside. So her BMI was somewhere around 17. So she had been referred to us. One interesting she told us when we were taking the history, Dr. Venkat and myself were seeing her, she said, the only thing that stops my vomiting is alcohol. And the psychiatrist in Manipal had got so desperate, he said, okay, you drink every day. But you can't do that, isn't it? She got gastritis and all that, so she couldn't drink. That gave us a clue that there is something wrong with the mechanism what we call as GABA, gamma-aminobutyric acid. It's the most important inhibitory neurotransmitter in the brain. And what we did a TMS investigation into the GABA activity. So using transcranial magnetic stimulation, you can estimate GABA activity, and what we found is the subunit GABA-A activity was very low. So there is a medicine called as etifoxine, which is a recent introduction. It selectively modulates GABA-A. We gave her that medicine, last 3 weeks, no vomiting. Vomiting is stopped. So if you understand it in this way, you can offer treatments which are very specific. You now have epigenetics. Genetics is now old stuff. Epigenetics is the new genetics. You have neuroimaging, where there are so many types of neuroimaging, ranging from the complex magnetic resonance imaging, which can be, structural, functional, even spectroscopic, where you look at the chemicals, to the what I call as the poor man's MRI, which is the FNIRS, which can only look at the top part of the cortex, maybe 2 to 3 mm of the cortex, but almost sometimes gives the same result as an MRI. So you have all this. I am sure SVASA has most of these things. FNIRS, I am sure they have. A simple example here, this is a study done by Dr. Kalyani, who is the daughter of Dr. Gangadhar, the former director of NIMHANS, when she was an MBBS student. Very simple study. All of you do this every day, chanting Om. What happens to the brain when you chant Om? In this fMRI study, we showed that actually while chanting Om, the limbic part of the brain, which is the oldest part or the most primitive part, actually gets less blood flow. There is deactivation of the limbic part of the brain. It can be very simply shown in it's just Om versus another sound which doesn't have that effect like S or anything. Why does it do it? When you say that is Om or Brahmari, this is actually a stimulation of the vagal nerve. In fact, we call it as endogenous vagus nerve stimulation, right? Because you can get a vibratory sense in your ear that is actually the afferent of the vagal nerve which is being stimulated. and this causes this change. So parasympathetic stimulation causes deactivation of the limbic regions. Why is the limbic region important? It is the seat of all our negative emotions. Anger, disgust, all that is centered in the limbic system, right? So this is such a simple example, but such a profound thing. Imagine this is happening just when you are chanting Om for 10 seconds. If you chant Om every day for the rest of your life, what's going to happen to your brain? You just imagine. This is what I think Dr. Manjunath was talking about, that long-term meditation is now very clear that it selectively increases cortical thickness in different parts of the brain, particularly so in women. This is a study which has only women, yoginis, so who have done long-term meditation, and the cortical thickness is much more than people who have not practiced yoga. This is something very remarkable that can happen even at an advanced age. Why I say advanced age? This is a study that we did at NIMHANS. In fact, it is done in most people who are staying in this Banerghatta Jigni road. Many old age homes are there here. So we went to one of those old age homes, Dr. Hari Prasad doing his PhD, taught them yoga for 6 months. And what happened? You can actually see an actual increase in the size of the hippocampus, right? So this is remarkable because these are all 60, 65, 70-year-old people. Hippocampus, what happens with age? It becomes smaller and smaller. And that is the root of cognitive decline in Alzheimer's. And if you can change it with just 6 months of yoga, if you have done yoga your whole life, you can understand why cortical thickness is more in people who do yoga. This is another recent study from schizophrenia where we talk of something called as the default mode network. So when we are not doing anything in particular, maybe some of you are in that state now, your mind goes to this default mode network, right? In people with schizophrenia, it is very much disturbed. So they have lot of what is called as mind wandering. The mind wanders to unnecessary places and there is no self-monitoring. The person is not aware that his or her mind is wandering. This is because of the disturbance in the default mode network, and we were able to show that after yoga there was a definite change in the connectivity of the brain. So what we have done at NIMHANS, I'll just give you a brief glimpse. Ayurveda, of course, in NIMHANS was there since the late 1950s, but I am sad to say that it was never really integrated into the NIMHANS system. There was fault from both sides. Everybody was happy sitting in their own offices. Nobody did any great collaborative research. It was reactivated only recently. But yoga, clinical research was there since a long time, 50 years. But the era of clinical application of yoga started with Dr. D. Nagaraj and Dr. Gangadhar in 2007 when we established the Yoga Yoga Center. So that was in 2007 with the help of the Morarji Desai Institute of Yoga. I should really thank them. The work done there stimulated NIMHANS to establish, this was a project mode, the 2007. 2014 we established a NIMHANS Integrated Center for Yoga. That led to the establishment of the Department of Integrative Medicine, full-fledged department with faculty of Ayurveda, Yoga and Modern Psychiatry together. That is what Dr. Manjunath was saying, the first institute of national importance in India to establish a full-fledged Department of Integrative Medicine. And last year in October we conducted a workshop for 18 All India Institute of Medical Sciences plus PGI plus Jipmar Pondicherry, how to establish such a department. So the ministry asked NIMHANS to conduct a workshop for all these 18 directors of all the AIIMS, all the institutes came. So everywhere it is going to happen. So all of you, if you are in tune with integrative medicine, you have wonderful opportunities waiting for you. So what we have done over the last 15-20 years, maybe 15 years, we have developed specific yoga modules which can be tested in trials. Because if you look at all the yoga publications before maybe the new millennium, yoga works for this, yoga works for that, yoga. I mean, what is that yoga that you are talking about? It is like saying medications work for fever. What medications are you talking about? What is the protocol? How to do it? Can I repeat it in Germany? Can I repeat it in Australia? You have to be very specific. What yoga, taught for how long, how was it taught, if possible, have a video. Be very, very specific. So we have developed, the ones in bold are the things which you have already done. You can add anxiety, to that list already now because we have done it. What we do, we look at the yoga texts, we look at these experts, we send it to experts, put a module together, make the experts rate it, put everything together, then do a feasibility study, whether it is possible to do, is it a problem, is there a safety, and then we use it in clinical trials, maybe initially non-randomized, finally randomized controlled trials. So we have done this for almost all these disorders. Ayurveda also, work has been going on, but most of the work was focused on not really the core preventive aspect, more of the treatment aspect. But after we established, now we are trying to look at a more holistic aspect from 2019. Dr. Kishore, who is the current head of the Department of Integrative Medicine at NIMHANS, actually did his thesis in the Department of Neurophysiology on Ayurvedic treatment for depression. So what we have done, we have put clinical services, integrated training, hypothesis-driven research, and development of courses together and made this Department of Integrative Medicine. I'll give you a brief glimpse of it. So these are the people who are involved. You might have seen them, many of you would have come to SVASA for one conference or the other. So we have three objectives: clinical services, training in human resource development, and research. So this is the important thing when we say clinical service. It cannot be three different rooms for three different specialities. Then you don't know what happens. Again, the patient has to choose, see three people, spend three times the amount of time, and possibly you don't know what the modern medicine person is telling about the Ayurveda person. You don't know what the yoga person is telling about Ayurveda person. Nobody knows, isn't it? You have to have it together. It is not a practical thing for the community, but what we hope is that the student who is being trained by these three people will be able to be an integrative physician. So that is why we hope to ultimately have a course in MD in integrative medicine. We have proposed that. We are running into some problems with the registration part of it, but I am sure it will be solved. So these are the milestones that we started in 2019, initially OP, then COVID came. So there was a delay in opening IP services, but we have started it in 2021. So we have a OPD 3 days a week, and we have a 30-bedded ward where we have full-blown Panchakarma services available. Yoga, of course, we have a very well-equipped yoga center at NIMHANS, and we have the Panchakarma. I think we do around 60 Panchakarma procedures. And this is kind of a map of the diagnosis that we treat. As you can see, psychiatry is mainly severe mental disorders, schizophrenia, depression, bipolar, psychosis. We get a lot of neurology. Most of the inpatients are actually of neurology. We get, radiculopathy, Duchenne muscular dystrophy, hemiparesis, stroke, other dystrophies, some rare conditions like Hirayama disease. There is some unusual condition called Hirayama disease which affects young males and they lose the power of the hand. It's a very funny disease because it goes in a geographical distribution. North Karnataka, Andhra, Telangana, Orissa, West Bengal, all the way up to Japan. In most of the other places it is not there and affects only young males. Now there is no real treatment for this other than putting a collar in the neck. And we have been doing yoga, and the neurosurgeon at NIMHANS, Dr. Nupur, told us that till now, when cases are very bad, they surgically operate the neck. He said with yoga, the number of surgeries he has needed to do has decreased by 50%. So these are the number of people who come approximately, in a quarter, in a month we see around 2,000 patients who come for yoga. These are inpatients. We have courses, PhD, we have postdoctoral fellowships for both allopathic MD psychiatry as well as Ayurveda MD psychiatry in NIMHANS. We have MSc Yoga Therapy, which is, already 2 batches have come out. And the flagship course we started is the MD Ayurveda Manas Rog that we started in 2022. The first batch will come out in 2025. And as I said, we are planning this course we call as MD Family Medicine Integrative Health. This is something that we want to start. Of course, we conduct a lot of short-term courses, which I don't know whether any of you are all eligible to actually join that certificate courses in integrative medicine, which actually the inspiration came from Guruji. Nagendra ji was the first person to actually tell us to do these courses. So this is the courses we are running. And as you can see, people are talking to each other, and the number of people who are joining these courses, we had to actually limit this time to 100. We were getting more than 200 applications for the course. Research, we have around 17 to 18 crores of funding in the last 5 years, including a very important grant, the Center of Excellence grant, the Ayush Swasthya Yojana of the Ayush, and several welcome DBT grants as well, and of course MD, PhD dissertations. And a lot of SVSA has been a fountainhead of inspiration for us from the new millennium. In fact, the first paper in schizophrenia was actually done at SVSA, where they added yoga for schizophrenia. In the year 2000, we have taken inspiration from that. So this is Center of Excellence, which was opened by the Minister of Ayush at that time, Sarbanand Sonowal ji. And this is a flagship project, the Center of Excellence project, we call it as Yantra. What we are trying to do here is take 4 major disorders: multiple sclerosis, mood disorder, Alzheimer's and schizophrenia, look at the Prakriti and Guna, use genomics, neuroimaging, gut microbiome and immune parameters. And finally, look at what Dr. Gangadharanji was saying, precision medicine. One medicine will not suit everybody. We want to look at the mechanism, we want to look at personalization of medicine. We also want to generate human resource and create a unified database. So this involves around 2000 subjects in total. So this is called as the Yantra project, which is ongoing now. So we have published around 50 articles, 50 papers per year with around 500 citations, and the H index of the department, I think currently is around 27. Most importantly, I want you to be aware of what are the kind of papers, opinion pieces, case reports, and non-randomized trials, randomized controlled trials, systematic reviews, finally meta-analysis. And I was telling Dr. Manjunath that the current gold standard for evidence is network meta-analysis, which puts meta-analysis together and gives the strength of evidence for each intervention, what is called network meta-analysis. So this is something that we really need to learn. It's not very difficult actually. It sounds very fancy, but it's not very difficult if you know how to do a meta-analysis. And we collaborate with almost all the departments of NIMHANS. This is something that all institutes should really do. Collaborative work is the key for going ahead in research. And our work has been recognized by, as usual, more by the outside people than, the Indian government. The NICE guidelines, which is the guidelines for the whole of UK, incorporated yoga into treatment of schizophrenia in 2014. And the UK Parliament, I think Dr. Manjunath knows, has a group, parliamentary group on yoga. I don't think the Indian Parliament still has. That's the sad part what Dr. Gangadharan was talking about. And based on 2 high quality trials from NIMHANS, they have actually added it in the NICE guidelines. So to summarize in one slide what we have done, of course, we have made specific modules of yoga which improve symptoms. But very importantly, we have to look at this green side of the slide. How does it work? What happens? Because science is important, not something happens, how does it happen? Unless you prove that, nobody is going to accept it as scientific evidence. So this is the work that we have been doing. And we have published 2 books. This is on the way. This book is called as The Science and Art of Yoga in Mental and Neurological Healthcare. So this was published through the Indian Psychiatric Society. It's available on Amazon. We are planning to publish a similar book in Ayurveda by next year. So I'll give you just an example before I close my talk. Example is Parkinson's disease. This of course is something that is done in collaboration with SVSA. Nupur and Kashinath Maitri. Kashinath Maitri was a faculty here at that time. So we developed a particular yoga module for Parkinson's disease. And then we did a trial. This is an open label trial. Now a randomized control trial is actually going on at NIMHANS. Dr. Pooja, a neurologist, actually conducting a trial. So this is what I mean, that you have to develop a standardized protocol and then you test it, feasibility, and then you do a trial. Similarly, we have done some integrative medicine work recently with degenerative disorders like spinocerebellar ataxia and Guillain-Barré syndrome, which again is a neurological disorder that comes on very suddenly and can actually kill a person because the neuromuscular junction simply does not work. So respiration stops, and if the person is not treated immediately with plasmapheresis, the person could die. So we have shown that integrative medicine can enhance recovery in both these kind of disorders. So to summarize my talk and not keep you from lunch too long, really we have to go towards integrative medicine. There is no option. We have done the whole thing in modern medicine. We have tried to go to the, just the modern medicine treatments. It simply does not return the person to health. So integrative medicine is the way forward. It benefits not only patients but the healthcare system. We have to do the economic calculation also. Otherwise the government is not going to listen to us. Right? Why would they want to change anything? It saves so much money and time, which is very critical right now. The Western world looks everything in the terms of DALYs, disably adjusted life years, and even more so economic cost. Economic cost of diabetes is, some hundreds of trillions of dollars. Right? So if we can nip diabetes in the bud, it is like earning trillions of dollars. See, money saved is money earned. But we really need to collaborate together, and for that we need to work together, most important, and we need to do high quality research. High quality research does not need to be done in any big institution. You can do it in a clinic, provided you follow proper methodology and keep good records. I don't know whether you heard of one Dr. Bhavaskar. There is a person in Maharashtra, one Dr. Bhavaskar, is a simple GP in a PHC in Maharashtra. He has published his work in NEJM, he has published his work in Lancet, British Journal of Medicine. Why? Because he is the world's foremost authority on scorpion bite, because it happens very commonly in that area in Maharashtra. The British Medical Journal editor could not believe that this person has done this work. He came to Maharashtra and he saw the records. He was astonished because this person had kept such immaculate records that they had no option but to publish it. Right? So he and his wife are PHC doctors. As you can imagine, they are at the lowest level of speciality, but he has published more than professors in AIIMS. He has published better than people in NIMHANS. Why? Because he maintained such good records and he did single-minded work in one area. So if you choose an area, do single-minded work, as Dr. Gangadhar said, 10, 20 years of your life, you are bound to get results which will make world news. So what we expect from Ayurveda, I promised I would end with this. We expect you to be a master in your own field first. You cannot be an Ayurvedic expert by knowing just modern medicine methodology. You have to be very good in Ayurveda first. You have to have confidence in your own system. If you are going to treat using paracetamol, that there are millions of people who know how to do that. We don't need you for that. We need you to be expert in your own specialty and then provide this advice, whether it is Ahara, Vihara, or it is Ayurveda pharmacotherapeutics. You need to have a scientific outlook, because if you quote Sushrutha to a modern medicine doctor, that he is not going to understand it, isn't it? I mean, he has never read Sushrutha. So for you it may be very important because you understand it. He will not understand. You have to be able to talk in the modern scientific language. You have to do hypothesis-based research. You have to have an idea what is going to happen, make a hypothesis, do the research, but you have to work together with interdisciplinary. Ideally, SVSA has almost everything. You have doctors in all specialities, you have scientists, you have Ayurveda, you have yoga, you have naturopathy. This is the kind of atmosphere in which good research can be done. Use technology to the maximum extent possible, this will take you places. I would like to end by acknowledging all our collaborators and the people who inspired us actually, starting with Professor D. Nagaraja, Dr. Gangadhar, the team at the Nimans Integrated Center for Yoga, and of course, most importantly, all our people who taught us the art of Ayurveda and Yoga, including S. Vyasa. Thank you very much.
Thank you, sir, for the elaborate and inspiring talk. I now request Dr. V.R. Ramakrishna, sir, Director, SAMCH, Dr. Manjunath Sharma, sir, Vice Chancellor, SVASA, Deemed to be University, and Dr. Alok Roy, Principal, SAMCH, to honor our keynote speaker, Dr. Shivarama Varambally, sir.
Sir.
Thank you, sir. Thank you, dignitaries. We now will break for lunch. I request all the delegates to return back by 2:20 p.m. sharp. We have our next session starting at 2:25. Kindly return back by 2:20 p.m.